Hi, I'm Dr. Devayani. I'm a plastic surgeon practicing in Mumbai. Today we are going to discuss the hot topics which always get asked about. What is better for you, whether it is breast implants or is it breast fat grafting? Now let me break down the topic a little bit for you. What do we mean by breast implant surgery? It is typically done for patients who are seeking breast augmentation or an increase in the size of their breasts. With breast implants, we can change the volume and the size as well as the shape of the breast. And what is breast fat grafting? Breast fat grafting is mainly used to enhance the volume of the breast. Whether or not it can change the size and shape a little bit is a nuanced topic which I'll discuss in detail. But breast fat grafting includes fat which is taken from the patient's own body, cleaned, processed, and then injected into the breast. Now, when it comes to breast implant augmentation, we are talking about inserting a foreign object into a patient's body. There are different types of breast implants, and which one is right for you depends on what you're looking for. There are saline implants, there are silicone implants. Silicone implants have gel implants, and there are gummy bear or highly cohesive implants. The ones which are most popular for breast augmentation are the gummy bear implants, which hold their shape, so they are very highly cohesive. So the advantage of gummy bears or highly cohesive latest generation implants is that they hold their size and shape even when placed under stress. So even when this implant is cut into half, you will have two separate pieces in your hand. They will not leak or rupture, or there would not be any reaction to the silicone. These implants are very inert and totally safe to be inserted in the body. Saline implants, on the other hand, are placed in the body and are inflated with saline or water. So this causes a slightly different texture and consistency to the implant. That's what makes saline implants not as popular for breast implant or augmentation surgery. Now coming to fat grafting, this is a little longer procedure. However, the recovery is very quick. This involves taking fat from parts of the body which have fat to spare, typically the lower tummy, inner thighs, flanks. We take the fat, we purify it, process it a little bit, and then it is re-injected into the breast. How much fat can be injected depends on how much fat there is to spare and how much the breast can hold. So over-injecting or under-injecting the breast can be problems. So this also depends on assessing the patient properly and the surgical technique. Now, talking about the longevity of these procedures, a breast implant can last for anything between 15 to 25 years. And if you maintain your body weight and your overall physique, then the results also will last as long. Typically, patients come in for a change or an alteration of the implant only when their breast size or shape has changed, such as after pregnancies or lactation, or they have lost or gained weight a lot and desire a change in size. Breast fat, on the other hand, once it's inserted and once it makes the breast its home and starts thriving there, is permanent. You cannot really change the size or shape once it is inserted. And it will change with your body weight fluctuation. So if you put on a lot of weight, yes, the breasts will start to feel heavier. And if you lose weight, the breasts also will become softer. So this is the basic difference between the two techniques, and that's why we customize it for our patients based on what they want to achieve. Surgery-wise, both are extremely safe procedures. Breast implant procedure typically takes up to 1 to 1.5 hours and can be done as a daycare surgery. Breast fat grafting takes a longer time. It takes about 2 to 3 hours depending on how much fat can be harvested. And usually we recommend that the patient stay overnight, but it can also be done as a daycare procedure. With breast implants, you can achieve a wide range of sizes, right from 150 cc's, which is very small, to 400, 500 cc's in size, and that is achievable in one step. Whereas in breast fat grafting, only 1 to 2 cup sizes can be increased at a time because, as I said, you cannot over-inject the breast. I already spoke about longevity. These procedures both last for a good number of years, and depending on what you want, we can choose what procedure needs to be done for you. Women always have a concern, especially when they haven't had children, as to whether breastfeeding will be affected or their pregnancy will be affected. So no, both these procedures do not affect pregnancy or breastfeeding. Breast implants go behind the breast and we do not alter or touch the breast in any way, keeping your feeding potential intact. Breast fat grafting also goes in between the breast in different areas. So though it is inserted in the breast, it does not really affect pregnancy or breastfeeding. Risks involved with the procedure are very minimal, and apart from healing period of around 2 to 3 weeks, most of these procedures are done seamlessly and give quick results. To summarize, what is the crux of decision making, whether you need breast implants or you need breast fat grafting, this is what we think about. So if you're a young person who does not have much body fat but wants to get a good sized breast increase, then you should go for breast implants. These are easy to use, they give a measured increase in size and leaves no room for errors, and they can be even done when you don't have enough body fat. However, if you're somebody who's already had children or who's been through pregnancy or who's lost some amount of weight, the breasts have sagged a little bit and they have just deflated in volume, and volume is what you're looking for mainly and not upliftment, then breast fat grafting will be a better procedure for you. Of course, I'm assuming that you have some body fat to spare. So these are the basic differences between the two procedures. What is ideal for you will depend on what your needs are, how your body type is, and what exactly you're looking for. So if you find this information helpful, please don't forget to like the video. Please share it with those who may find it useful as well. And thank you for watching.